Sylvia.
Hello.
Can you hear me all right?
I can hear you. I think she's muted, but I can
Oh,
hear
yeah,
you.
you're muted.
We can't hear you. Oh, there you go.
Yes. Hi, Miss Sylvia. Let me change my name. Hold on. Let me rename myself.
I didn't even know you could do that.
Yeah, there's a three dot when you go on top of your photo. There's a three dot to the right, and you can rename yourself.
Now, see, I don't have that. I just have something that says view, but that's okay. My name is what it is. I better take off these glasses. It looks a little too.
Great. And then, Alin, it's only this part to this part we can see. Is there a way to shift? Yeah. Oh, look at
No,
you.
I don't. I've tried.
Welcome to Voice of South Pacific Broadcast in Radio Tonga, Seattle. This is our live broadcast from Seattle, Washington. Today is March 17th. Thank you, everyone. Please share the program to your friends and everyone, especially those you know that in the King County and the city of Seattle, so you can hear our great program to welcome those from the Food Equity Fund. Mala la maria hau eke pe malele tongo toa ta te a sia mo i mai ai aho tople lulu ko ma asi a ta fitu o e wa fe wo wa ko fa malo heni ko nga ko ke lava ke tau ke filonga ki e va hau pe i amerikani pe mo tople anga foki pe ko ia ai ko ma polo kalama ko e aho ni ko ngai polo kalama ni ngai ba ke ko ia e pule anga Aia ki hene ka whafofonga pe me City of Seattle, aia ko e Food Equity Fund. Hange ko ki motolu ko ia i he kau taki lotu, hange ko ngai taki ngai waa ko ia ai community. Pe ko ngai kulupu pe, e tokone lahi hene ka ki motolu, ke mo lava o ngawe aki a ngai whainga maari e ko ni. Pea i he konga hono ua, ko he hoko totonu e ono, te tau kau whatare vai, mo ngai whanongonongo mahu inga o mai, pea mo ngai whehui o tuku atu ke King County Public Health ma Christina Brede. But I would like to welcome Lona and Aline from the Food Equity Fund. Thank you so much, for taking your time to join with us. As you can see, the flyer on the background. We are so grateful that you take the time, to be with us today. And this is a great opportunity that we can be partnership and also share the relevant information that will make a difference, in the people's lives as far as helping others and also serving others. Pea mga hitokoni ko ia e lava ke mao mai pea me City of Seattle. Okay, thank you, Lona. Lona Velasco is a project manager for the Food Equity Fund, and she's here with Arlene. Thank you, my two Voice Pacific staff for today's show. I would like to welcome both of you, and I would like to ask you, Lona and Arlene, please, if you could introduce yourself and tell us about the Food Equity Fund. Thank you.
Hi, my name's Lynn Ruth. I work for the Department of Neighborhoods. I've been doing grants for probably 32 years. This is my first year with the Food Equity Fund. My coworker Lisa and I spent about a year or more trying to put this funding opportunity together. I should tell you that the money comes from taxes that are collected when you purchase Coca-Cola, Pepsi, or other sweetened beverages. Those taxes are collected in Seattle. And unfortunately, the only place we can spend the money primarily is in Seattle. So while you may be listening from King County, our hope is that we'll be able to find a way to partner with you for activities in Seattle. The only way we could fund it outside of Seattle is if we collect the tax outside of Seattle. And right now we're not doing that. But this opportunity is for people who are doing great work in the food space. There might be growing food or delivering food or cooking hot meals. The idea is that we want people to eat more intentionally, be more intentional about their health, but in cultural ways. I'm an African American. I know I should eat healthy, and I don't particularly like kale, but I like greens. I know I shouldn't put pork in my greens, so we started years ago using smoked turkey necks. I now drink 1% milk instead of whole milk, but because food is so important to a culture, we know that if people are going to change their nutritional habits in a way that's effective and long lasting, it has to be in culture. Food is so important to families, to culture. That is how we connect as families. I know that's true for me as an African American. That is how my mother showed love for us, is she cooked for us. And she taught us to cook and pass on those traditional things that we made from the times, frankly, from the times we were slaves until even now. Those things are important to us. So we're hoping that you who are listening and who have roots in Seattle or Seattle address and are wanting to provide culturally relevant food to your community will partner with us. And I hope this isn't the last time we have a conversation or the last time you listen to me. The opportunity opened March 1st. It'll close April 30th. And it's for projects that need between $80,000 and $150,000 from the city. We've already done tier 1 for smaller endeavors. That process just closed and we're contracting those. But an organization could be a 501c3, or it could be just an ad hoc group, a group of people who get together. They may not be formally organized or recognized by the state. They could be 10 people who live on Cherry Avenue and call themselves Cherry Avenue neighbors and decide they want to distribute food or cook food or grow food. There's a variety of ways that people have come to us. We've funded projects where people were growing food on a farm. They were having nutrition classes. They were teaching young people how to grow food. So there's a variety of ways to access the fund, and it depends upon you, your culture, and who your target audience is. For the purposes of this fund, the target audience for us is the BIPOC community, Black, Indigenous, people of color, Pacific Islanders, Latinx, immigrant and refugee people, seniors, youth, people with families. So it's a broad range of people, and we're not looking at a particular neighborhood. We're just looking at serving the city of Seattle. So we know that some of those populations might be concentrated in the South End. They may also be in North Seattle. It may be in Delridge. It might be in the central area. It's where you live, where you congregate, and where the need is. So we're hoping that we can have a conversation. There are 4 project managers. Lauren and I are here tonight, but there are 4 project managers. We have workshops. We just had one last Saturday. I think our second workshop is Wednesday morning between 10 a.m. and 11:30. There's a video that we play that outlines the program, and then we have about 45 minutes to an hour for questions. If you attend that workshop, we'll sign you up and assign you to a project manager who can help you understand the program better. We can help you, we can review your application before you submit it. We can connect you with resources, help you find a fiscal sponsor if you're an ad hoc group and you don't have a fiscal sponsor that's a 501c3. So there's a lot of assistance we can provide to you. And we know this is important work. We know that this is the first year of the Food Equity Fund. We know that there will be improvements. There are things we could do better. There are things we need to be more intentional about. There's also an opportunity to be a reviewer. This process has community review. So there'll be 3 people from the community who are part of the review team. And so if you don't have a project idea, but you want to be on the cutting edge and help decide who gets the money, I should tell you the last round, we got 47 applications, 46 were eligible. We do offer a stipend of $750 to compensate you in part for the time that you would spend reviewing applications. But you might want to be a reviewer, so we do have an application process for that. I'm going to stop talking now and let Lorna give some perspective, and then maybe we can take some questions and do that. But I'm going to let Lorna speak up. Hey,
Thank you
Lorna.
so much. Hi, Ellen.
Thank you so much, Aline. Before we continue on with Lorna, I just wanted to say something in our native language, like to the people that are listening. But we will definitely, this is a great, great information. And I think that it's a blessing for our community and the leaders to know about this Food Equity Fund and how they can participate. Koe ai koe hange koe nei whamatala mai koe ni e Aline pea me he City of Seattle. Ko Aline unau tonga ngā e tawhaaki koe ngai tokoni ke mea tokoni unau ilo how important it is to have the food. Pea koe ia koe polokalama koe ni koe me whakate whito ka pau te tau service haka kai I he City of Seattle. Aia koe paanga I walumano ki paanga tā kilo. E lava lelei I he tau kau taki lotu ko ngahi taki ko ia I he ngahi club kawatonga pe ko whepea ngai kulupu te mo lava o volunteer ke mo hanga taui mo taimi he ko I ngā kone o mai sirin ko ni ke toko ni atu I he taimi ko te mo whai ai ngā we pea ko mo arrange pe mo tolo mo ngai fo I kulupu ke mo whakahoko ia o aito ha mo ki pret me akai moho tu whatu pe o koe ke lawe ko pe o ko oswai he takotaha koe he kulupu koe e ngāwe I kai. Ko sirini o ata ki he taha ko toa pepe ko ia mat ak mau inga. Ngāwe ake whainga Maria. Thank you so much, Aline. And now we are going to go to Lorna. Thank you, Lorna.
Thank you so much, Miss Sylvia. Ellen and I are so incredibly grateful to you for letting us be a part of your broadcast for Voices of Pacific. What's really special about the Food Equity Fund is that it is focused on community. And so it is, community-led programs is what we're looking for. And it's on the simple premise that people of color, communities of color are best equipped to affect change within our own communities as it relates to food access issues, as well as health inequity issues that we face day to day. And so Ms. Alin said about the priority population is the BIPOC community. We're looking at place-based focus groups on activities, community-driven, and also community and culturally responsive. So these grants are available. Our application is up on our website. And so if you're able to see, this is our flyer. And our website is seattle.gov/food-equity-fund. Our applications are up. And so we encourage everyone to go see our applications, start applying. Our deadline is April 30th. And so it is coming up. We have some time. And for those of you who are interested in finding out more, asking questions, and we can even review a draft of your application before you even submit it for final application. So you can send it to us by April 16, and we'll give you some input and insight on how to make your application competitive. So we encourage everybody to apply. This is a really great grant and fund. And what Ms. Alin said about the fund is coming from sweetened beverage tax collected in Seattle. And for eligibility purposes is that, you have to have a Seattle address, but we welcome you to partner with different communities and different organizations.
Lorna. Hange ko yana ne whamatala mai. I'm sorry, Lorna. I will just say a quick little version in our language. Hange ko yana ne whamatala mai. Lava pe ke mo partner hange ko ni ka pau ka kautaha tu I Seattle. Pe ko ha wharelotu. Hange pe ko tau whatata ko sas afitu wana whalotu tu I Seattle. Pe ka pau mo lava mo tofa ngawe atu ki tua. O ngawe aki ai paanga lahi ko eni o tuku mai. Ko paanga valumano ke paanga tā kilo. Pea ko I ngā whaki ko e tokoni eni pea me he kautaha ko ia me he sota ko ia Coca-Cola. Pea ko I ngā whaki hange ko e totongi text ko ia nau tolu. Pea ko la vai ke whai tokoni pa ko I tau mua ke whawhanga ai toko taha ko tope. Pea koe te mo whanonga mai pē ki hono ngai whakaikiki kai ki lava o mā ukupu atu ai ngai whakamatala. Ka te whenga pē te mo lava pē te whanonga i rea whapapālangi. Pea koe tukat pē whainoina ka ki mo tonu. Ngāwe aki ai whainga māri koe ni. He koe whainga māri whafu ofanu nau lava tuku mai. Pea e lava pē mo tala nau. Lahi pē no ngai whonga koe ki pē ia. Ke nofo ko ia i CTEC pakai ki toi lava koe. Iai pē ha partner ia au o nofo i he City of Seattle, pe ko ha wharelot, pe ko ha wharekala, pe ko hape, te mo lava le rei ke mo ngawe aki ai whainga mare koe ni. Thank you so much, Lorna. And I have just a quick question here that was just texting, asking, so according to what you were just saying, we can still partner even if we may be out of the city of Seattle, but we can still partner and we can still to serve the residents of city of Seattle, right? Or if you can clarify that part.
Yeah, this is Alin. That is true. For example, we learned through the first tier that a large part of the Pacific Islander community lives in Snohomish County. However, there might be a church or another organization that is a gathering place or a cultural space for your community. If you wanted to, and there might be someone in your community who does live in Seattle. They can use their address as the chairperson or the leader of the ad hoc group, and you can then use that as the jumping off place for grounding your project in Seattle. And if the project activities are in Seattle, the people you're feeding are in Seattle, then it could happen. Even if other people who might be helping out live somewhere else, if the leadership and there is a Seattle address, you can do that. And we realize this is not perfect. Lorna nor I were not anywhere around or involved when this ordinance was put in place. I could have told them that the African American community no longer lives in Seattle, but no one asked us. This happened 3 or 4 years ago before I even knew I would be assigned to the work. So sometimes well-meaning people put things in place that for a variety of reasons are no longer relevant. And given the pandemic, we have tried as hard as we could to shape this program in a way that responds to the pandemic. 5 years from now, when we're through this pandemic, I hope, the program might look a lot different. But we are dedicated to putting as much food into people's mouths, as much money deeply into the community as we can right now, as much as the law will allow us. And I'll let Lorna add to that if she has anything to add.
No, you said it perfectly, Alin.
Thank you, Aline. Hange koe na e whamatala mai, koe tui kono whama ala alaini. Hange koe na kuna o stala mai. Hange pēr tau whatata o kai whare lotu o sas katolika o kuna tuu i aia koe toa sila tu i Seattle i hala o kasi. Ka pau koe whare hange koe tau pehe. Ka pau koe whare lotu o sas katolika. Ka pau ke lotu pe ko ia i ha whainga palo kia. I e wheitua pe ko Federal Way pe ko Ken. Ke lava pe ke mo alea i ko whea taim ata. Ke mo hanga o whatau atai pe ko whamare ukai ki whatau. Ke mo hanga ngahi pea peret me akai pe ko tō taha e week. How many times a week? I'm sorry. How many times a week? Did you hear me? Lorna and Aline?
How many times a week for what?
To serve like, let's see, if they cook food, how many times a week do you know?
That's up to your program to decide. Some people serve meals twice a week. Some serve once a week with a nutritional component. It's up to the capacity of each organization. Now, tier 1 people, the most they could apply for was $75,000. Tier 2 people can get $80,000 to $150,000. So maybe they'll be providing food a few times a week and delivering food and doing other things. But we don't tell you. You tell us what you'd like to do.
Thank you so much. Hange ko ia tau pe ko ia hange tui mo lotu ko i whare lotu ko nei i he o kasi Seattle. E lava lele pe ko hanga mo to arrange po ko to tahe weekend po ko to o weekend pa now ai ka to me pe me akai ko mo me pe ko ngahi pe ko ata ki pet me akai moho tu fat pe ke ka kai pe ko na no fo ko i fetu Seattle ange pe wai pe mo to la he kai nga tonga pe ai o na sas katolika Pea ko katoa ko tatau ka pa ko to tahe wiki po to tu owa aya me kamata pe me he paanga valumano o fai ke olong paanga taha wa ke taha kilo po alo ke taha kilo ni mamano ka ko futokon lahi ia ko nga ke tau ngawe ake fanga mari ko ni tuku mai me city of Seattle ka ko hange ko fare lotu ko sas afitu o na ia ko fare lotu ko ne sas mamonga pea oku lava le leipe ko ha pe ha kautaki faka community ta tau peha ka lapu pe koi hapeha whaahinga kulupu te nau lava ngawe aki ai whainga mare whafo ofa koe ni ma oi pe se niti lelei ke tokoni ke ngai whatongia ko hoko ka koe mea ko mahu inga te nau toki atu pe te mo te tāna po atu whai kiki ka oku ikai ke mo whatau te mea kai nau o mai ka tapina te mea tokonia mo whahoko pe ngawe pea koi ai koi hapeha mea ko te mo lafu tu tu e ko inga ko sai pe hange ko kau ko group so se ko ya tu tu ma sai pe ne ki kau club ko ki ana ko resina ko hai fote na la na to ko ni fa le ki fa pro kalama to tai week pe ko ya pe thank you so much. You can go ahead, Aline and Lona, and keep explaining to the process. And I think a lot of the people are interested.
I'm sorry, what is it that you'd like me to do?
You can go ahead and continue, with the process of the.
Oh, okay.
Yeah.
Well, I will say this: if you come to one of our workshops or you call our Food Equity Fund hotline, what we will do is immediately connect you with a project manager. It's really important that you at least talk to a project manager about your idea. For example, if you just call on the phone and say, do you fund a certain type of project? And we say, yes, we do, but you don't talk to us anymore. And you might come back and the project's outside of Seattle, or maybe you're charging for it. And we ask that things be free. There are a lot of nuances to our program that we'd like to help you with. And I always advise people to read the guidelines. We are a public funder, which means these tax dollars belong to someone other than me personally. They belong to the community. We are different than Bill Gates. Bill Gates is a private funder. He can change the rules or regulations anytime he wants to. As a public funder, once we announce our guidelines, we have to adhere to those guidelines until our next funding period. So if there's something you want to do that's not allowed and you include that in your application, it's going to be a no. So that's why, as Lorna alluded to, we can review your draft application and we can answer your questions so that what you propose is something that fits within the criteria. Because I can tell you in tier 1, we had $1 million available to give away. We had almost 3 million in ask. That was a lot of requests for the amount of money that we had. I think I told you we had 47 applications. One was outside the city, so reviewers reviewed 46 applications. It was highly competitive. They were only able to fund 19, so that was a lot of no's. There was a lot of disappointed people. But one of the things that we learned is that sometimes people don't answer all of the questions. They don't give all of the information, and you have to tell us what you already know. When people are reviewing your application, they don't know anything but other than what you put on the paper. So it's not about how long you write or the number of words, or a grant writer is, did you answer the question that was asked? And that's the kind of thing that we can help you with, because we want you to be successful. We really do. All of us who are working in this space really know how important it is. We believe in community, but we know how important food is. Food is an essential service. It's not like any other grant we have. It's not a park, it's not a playground, it's not a piece of artwork. It is something people absolutely have to have. So we're a pretty dedicated bunch, and we want you to be successful. We don't want there to be any money left. We'd like to get it out into the community and have you continue the work that most of you have been doing anyway, without any help from us. So we'd like to lift that burden from you if we can.
We'll go ahead and translate it into our native language. Hange koia na ne whamatala mai ko paupe ke whawhon ho application ni Aia ko e me whafofo ko application e ne whangful maono. Ka lau miliona ai sirin ko ne una ulotonga mao i taimini ke tokoni ki he mea koni whikau aki mo mea tokoni. Pe koe hape, pe ka pau iaha mo ki kalasi pe ia ko ai pe ki a ko i kakai ki anga i kuki mo i lelei. Pe koe hape aki i mea. Pe koe kuki aki i mea tokoni. Pe koe hape aki i mea. E lava o tokoni ke hanga whahoko i ki ngāwe ko ni tō taha pe tō oa he wike pe whakatau rewa a hono o atu koe o i wahe ki hok mo ki ngāwe ko whai. Pe kei ki mo ngāwe a kakato mahaka ki fo i hoa pe ni ma ko slava le waia. Ka oku tokoni au pito eni pa ko tui ko whainga mari le reini lava mau me ia whainga mari o i kakai tonga ke nau ngāwe aki. Ai ngahi whan ko ni utuku mai. Ko fusirini ko ni lau miliona ko ni utuku mai. Ko fusirin lahi au pito ki tau ngawe aki. Pea o ki kai ko tau tolu pe, o ko ata peni ki ha matakari pe. Ka mahu inga, ko i tau whanongo tonu ke ngai whamatale uno o mai, pea lawa ke ne hanga o whakalotolahi ki tau tolu, ke tau whaha ki ngawe, ko mea pe whikau akma mea tokoni. Pe ko te tuwha pea ki i mea tokoni mata pe, pe ko te ngahia ki mea tokoni moho, pe ko pea oska whakawhi etu mo i kainga, kai ta te whito, ki a ngahi api nau tua sila ki Seattle, ko i ngā koe whan, ko i ni koe hau whoki me City of Seattle. Aia me he kautaha ko ia, soda koe mo i Coca-Cola. Thank you so much. I have one question here that was asking about the, please, when is the workshop again?
Oh, go ahead, Lisa. Go ahead, Lorna.
Sure. Thank you so much for asking that question. We do encourage people to reach out to us. And so there are a few ways. One is the workshop. We have one coming up on March 23rd, and that's in the daytime. That is from 10 a.m. to 11:30 a.m. And the next workshop is April 12th, and that is from 6 p.m. to 7:30 p.m. On Wednesday evening, starting this, this Wednesday, and also up until April 13th, we have office hours. So you can come in and register online for one of our office hours, and that is from 4 p.m. to 5:30 p.m. And you can also schedule a one-on-one meeting with us up until 7:30 p.m. on Wednesday evenings. We also want to encourage you can give us a call. Our phone number is 206-727-FOOD 3663. That's 206-727-3663, or email us at foodequityfund@seattle.gov. And we encourage you to talk to us about the project ideas that you have, how you want to support and feed your community. It could be like a gardening or farming program. It could be food and health education to your community. So there's a lot of ideas. Probably people out there are already doing and servicing your community. And this could be an opportunity to help you fund your people, your activities, and your programs.
And I'd like to say, start now. Please don't wait until the last minute, because it does take a little bit of time to fill out the application. But the earlier you start, the more help we can be to you.
Yes.
Thank you so much. So workshops start March 23rd. So we're looking at next Wednesday. Wednesday of next week, start at 10 a.m. to 11:30 a.m. Oh, somebody was just asking, the workshop starting next Wednesday, is that on a Zoom or in person?
Oh, it is virtual, and
Virtual.
I think is it on Zoom? Yeah, it's virtual. All of our workshops are virtual because at the time we scheduled, because of COVID, we were not sure whether we'd be able to meet in person. And also, we should also say that if either of those times don't work for you, if you're not available Wednesday evening, you can't come to the workshop, call the Food Equity Fund line or email us, and we will arrange a time at your convenience, whether it's in the evening, whether it's on a Saturday. We will meet you where you are. Those are just times that we put out there, but we are very open. There are 4 of us. We will make it work. Someone will meet with you, and we've done it. We meet people Saturdays. We meet people on Sunday afternoon.
At night.
I've had many a meeting right after church. That's how I found out about the first Pacific Islander community because they were at church. And I said, look, my church is over at 11:30. Call me at noon and we would talk about what they needed. So we will make an appointment that works for you.
Okay, hange koe na whamata la tu, koe workshop koe niu ka mata e pule rulu koe wiki kaha u. Pule rulu koe wiki kaha u, aho wa tolu ia, ka mata me taim hongo fulu pongpongi ki ta taha tolu noa pongpongi. Pea o lava pe ka pau te ai pe hau whehu i koe kia me e mahino ka koe, te mau lava lelei o to konya. Koe tau mu aha ia, ke mau hawhainga maari o tako tope. Pea koe whika telefoni e na o stuku atu, koe wanoa ono. Fitu wa fitu, tolu ono no tolu. Wanoa ono, fitu wa fitu, tolu ono no tolu. Ta lofa, ainga, yeah, we are going to put it out, in a Samoan language and also the Fijian language and Marshallese, to make sure that everybody could use this opportunity on
Oh,
this weekend. We will definitely circulate it, for you guys, and then we will try to translate it. Thank you so much.
that's
Yeah,
fantastic.
okay.
Thank you so
Thank
much
you.
for doing that.
Yes. So another question here that just arrived, asking, what are some of the requirements? You said you can help us with the application. Is the application is just like online only, or we can print it out and fill it out and mail it, or it has to be online only?
I can take that question. It's designed to be online only.
Okay.
We can definitely give you a printed version so that you can read it. I'm a person who has to have something in front of me. I don't do well online, but you do have to submit it online. That's really only the way we can keep track. So you have to submit it online. That is the answer to that question. The application is pretty intuitive. I always tell people there are 3 things that we have to know. We have to know what you want to do, which is really the project description, how much money you want, and how you're going to spend it. That's the budget. And how are you going to do it? And that's pretty much the timeline and the work plan. So if you say, my project is a pea patch, we're going to grow some food, we're going to distribute the food, and we're going to have a once a week meal, then that means when I look at your budget, I should see resources for developing the pea patch or maintaining it, tools, supplies, something. I should see something that tells me that you're delivering food, cost for food, and I might see some other ancillary costs. Then when I look at your timeline, I shouldn't just see the timeline for preparing the pea patch. I should see some things in the timeline that speak to when you start the meal delivery, when you cultivate the food, how you deliver it. So if your timeline and your budget and your scope of work are in unison, then reviewers can understand right away what you're saying. And it doesn't matter so much if they're reading 10. If they're reading 40 and 46, then those elements that stick out, that are clear and concise, help them to understand what you're doing. And then you can put, the meat on the bones. This is who we're going to reach out to, how we're going to reach out. So it's kind of important. That's what I always say to people. If you want to talk about getting a grant, tell me what you want to do. Don't have to use a lot of flowery language. What are the 3 or 4 elements of your project? How are you going to do it with this money, at this time frame? And then you can kind of work backwards. But those are just that's some insider tips. That's what reviewers look at. That's what they look at. If there's something in your budget that's so important, it's taken up $30,000, and I look at your project scope and it's not mentioned. I look at your timeline, there's no work associated on your timeline. That's a miss. If I read your project scope and there's 4 or 5 activities, there's no money to support it in the budget, you don't have a supplemental budget, that's a miss. So then I don't understand what you're doing. So, I mean, those are the kind of things that we can help you frame up.
Thank you so much, Aline. Thank you for clarifying those, and very helpful. I have one of our director that's our co-worker with Voice of South Pacific, Latu. You can pronounce it Latu. She's online. Latu, go ahead. I'm sure you're happy to share something, or you have a question, representing some of the young people or the community. Thank you.
Thank you for the time to ask a question. I read about this funding, but I'm glad that we get to hear someone who's able to help us. We have established First American Tongan community, and it's running very well. But I could see this is something that will be beneficial as we are. My question is, when you talk about the PPAD, do you provide an area of land that we can use, or we have to find that area ourselves? If
That
we are
that was
interested.
just an example. You would have to find that area yourself. But people have come to us. There's a Black Farmers Collective. There are other organizations that already have identified a piece of land that they're going to use. That's just one example. Not everybody does a pea patch. That's just an example. People are delivering food, they're cooking food, they're buying food and just delivering bags of food to their community. I just use that as an example. That's not a requirement. That's nothing you have to do. You best know how to serve your community, and maybe the food that is culturally relevant to you is not something that you grow. Maybe
Right.
there's a business
Yeah.
that you can get it from, because
Exactly.
Okay.
yeah, that kind of
Because
thing.
that's
So that was
something
just
that
an
we're
example.
doing now,
I'm not at all
providing
suggesting that
meals
anybody
and
should or
program
could
for
do a
young
pea patch.
people.
It was just an example.
But great.
Okay. Thank you.
Malo.
Hope it
Thank
answer
you.
your question. Thank you, Latu. Yeah. Yeah, okay. So that is a great thing too. You know, talking about food, I have to say food is a socialization for us. It is a part of our social life. If
Yes.
you don't have any food on any activities or any event, it's kind of like a poor event. If you don't really have a good event, but you have a lot of food, that's becoming like a wealth event. So I'm so glad that this is like an opportunity that will make our people to realize that this is a great thing, that they can participate and use the opportunities, because there's a lot of them, around in the Sierra area. I'm talking about the Pacific Islanders, and that would be a great resource to help the people to serve others, as how they can be able to get the opportunity of the fund, and also to serve the food. That is one of the best things, to serve the food. Yeah. Okay. I'm glad you clarifying all those points and the information. So if you don't mind, we already on 5:39 right now, which is 5:40. I wanted to just play a little song. We have a lot of people that pass in our communities, and we'll just play this little song, as we go along, and then about for 30 seconds, and then we can move on. Thank you. Yeah, thank you. Sorry, that's more like a spiritual song, for those that are passing. We have 5 lives in our community, in our Tongan community that passed. They now all rest in peace, and we're looking forward, to celebrate their lives, and the memories of those that left us behind.
Well,
Um,
thank you for allowing us to be part of that. You don't have to apologize. I'm a Sunday school teacher. I believe I'm a spiritual person. I believe in taking up time for those spaces. That's important.
Thank you so much, Aline. Okay, I have another question that just asking. If we are going to do all those, like, let's see, if I wanted to cook some food and serve with a group of people, depending, like, our community or our church groups, um, do we all required, to get the license, for being a cook person, like to get a license, to prepare food to serve to others? That's the question.
Are you talking about a food handler's permit? I'm not sure what you mean by a
Yes,
license.
yes,
You're
yes,
talking about a food handler's permit?
yes.
That's probably a good idea. I don't know that it's a requirement, but it's probably a good idea if you're going to be preparing food for the masses. A lot of people are just giving out packaged food, which, which is not anything you have to have some special training for. But it is important that if you're preparing food for the public, that you're paying attention to heating, cooling, and all of that. Most of the people who apply to us have been doing this for a long enough time that they're aware of that. But I guess I would have to know more about the individual project to know
Right.
whether we would make it a requirement. Currently, it's not a requirement, but there are some common sense things that you should follow, such as hot food needs to be hot, cold food needs to be kept at a certain temperature. We certainly wouldn't want anyone to become ill, from food that was prepared for them, even with the best intentions. So I would say that's a provisional answer. When we know more about the project, I'd know better. Because what are sometimes people are just serving things that is already prepared, already packaged, but even some of those foods have to be kept cold. So
Right,
got to
right.
be careful because we want to help people. We don't want, even accidentally, we don't want to make anyone ill. But most people have
Exactly.
been doing this long enough that they do know.
Yeah,
Thank
and
you.
we also encourage people to partner or seek out other organizations, like a nonprofit organization, for additional support. They may be able to answer or support you in like getting insurance, getting a business license. I mean, there's ways to partner also with different organizations.
Okay, that's wonderful. I think you answered all the question. Yeah, this person here said thank you so much. We got the information. Um, okay, well, I'll let you go ahead and because we only have like 15 more minutes, just to explain other information that you think um, it's necessary to share with the community abroad.
Well, I guess what I would say is that every project is unique. So I know I've said this before, but it's important that you connect with the project manager to talk through your idea. But every project is unique. Every food delivery project isn't the same. Every cooking project isn't the same. But I think if I had to say one thing, and then I'll cede the rest of the time to Lorna, is that it's very important to us in the Department of Neighborhoods to engage with community. And Lorna, Zach, Lisa, and I, we get no credit for having money left over. We want to give it all away. We want people to eat and be fed, and we really would like to partner with you. I will say this, though. There are certain parameters that we have to operate under, and this process is subject to community review. The people who make the decisions are not like, they're not city employees. There's only 2 city employees on the review team, and only one of them is going to be from the Department of Neighborhoods, maybe. So we deliberately, in this process, unlike other processes that we have, if there's 5 people on the review team, 3 of them are from community. We wanted this to be community driven and community led. And you might think that's not such a big deal, but that's a big deal for the city. Because I've been doing grants in the city for 32 years, and most of the time the review has been between me and my coworkers, other people in Don. So we are really ceding authority and leadership and power to the community because they're boots on the ground. They know of organizations that we would never hear of, and they really are closer to the need. And it's not that we don't care, but we are a bureaucracy. We're the city. We're just not out in the weeds, for lack of a better term, like you are. We don't know what you know. So I would just say that. That's all I would say. And I'll let Lorna have some time and space to give her perspective.
Thank you so much, Aline. I just wanted
Thank you,
to go
Aline.
back to what you said, Miss Sylvia, earlier about how food is so central to so many communities. It's
Yes.
central to the Pacific Islander communities, to my Filipino community. It is the heart in some ways. It what brings everybody together. It's a
Yes.
social gathering. It's ways for us to kind of engage with each other is around food. And what's so difficult being here in the Pacific Northwest is access to culturally relevant food. Food that is part of my ancestry, that's about food that's been cooked by my mothers, my grandmothers, and so this particular grant, we understand that and we know that, and so cultural relevant food is also a priority in terms of like what we want to see, the kind of activities that we want to fund. Access to culturally relevant food is very difficult. And sometimes, like health inequities that we face as communities of color is a particular challenge. And so this grant is a way to answer to that as well. And what's great about this grant, it's for the tier two. It's actually from 15 to 24 months. So it's programming not just for like a month, but it's for several months. So it's consistent and it's sustained efforts to invest in your community. It's also significant, the amount of funding that is available. It's 80,000 to 150,000. You can pay people, personnel. It pays for supplies. It pays for the food that you want to cook and distribute to your community. So yeah, we encourage everyone who's listening right now to please call us, talk to us about your ideas. We want to support you. We want your application to be competitive, but we need to do it earlier rather than later. And so 206-727-FOOD, or email us at foodequityfund@seattle.gov, or go to our website, which is seattle.gov/food-equity-fund.
And if you're not ready now, October 1, we open up another round of tier one, which will be for up to 75,000. So we're going to be doing this throughout the year. So if you're not ready now, and maybe you have a smaller idea, October, it's not too early to start thinking about October 1, because that will close November 30th. We're serious about this. We're
Yes.
relentless on food.
Yes.
We're going to put food in front of you whether you like it or not.
No worry, Aline. When we talk about like food, like I said, this is a wealth to our community, our
My
Pacific
culture
Islanders
is
community.
all about food.
You can maybe skip going to
everybody's
church.
is. It's
You can
all
maybe
about
skip
food.
going to heaven, but then as far as going to food, you won't be able to skip it. Yeah.
Shoot. I'm eating all the time.
Yeah, thank you so much. These are such a blessing, for you both to share this great information with our community, and we will definitely do the reach out. We will circulate it, in different languages, because we know how important it is, for our Pacific Islanders community to be aware of this great opportunity that you have. Take your time to share with us, and we feel very blessed. And thank
We
you so
want to
much.
thank you. We really want to thank you for allowing us to do this. You're giving us a significant amount of your time, and we know the importance that you hold in your community. And you could be doing a lot of the things. So we do not take this opportunity for granted at all. And we appreciate it very much.
Yes, Ms. Lily, we appreciate you. You are an amazing leader to your community, and we see that, and we want to honor that.
Oh, thank you so much. Same as you. Likewise, you are both taking your time, to serve this, even though it's just, from the city. However, you're the one, that on the front line, to reach out to us, and we are so grateful for that. Hange ko yung whalea ki ang whiwhine ko ni. One is Aline and one is Lorna. O tau whakawheta I he mao haka kai pehe nau whie viviri maho nau tai mihe nau wahe mai whainga maria lahi ko ni. Alpe me he walmano o a o ki he panga tā ki tipenia me he hae lahi koho o ngā ue. Pe koi hape haki I mea. Pe ko ai ha pret mea kai, pe ko tuwha pea ki pret mea kai, pe ko ako I ka kai ki ha kuki mo I lere I hange ko ni. Neonga pe ko ai ko tau tō pai ka koi ai ki tō pai, ai me ki whai ka kai, pe ko ai ha ki I super vesta polo. Hape mea te ke lava o wahe me community. koe mea koe koe tāpua ki, e koe lava vahe o ki taimi ke tokoni. Pea ko o mai ai sirini koe ni, mei he siri o Seattle, koe oku lau miliona, ka ku ave whafofua ke whai application ko tope. Pea te nau lava tokoni ka koe, ke whafono application ni toko ni i koe nau tau muaha ia ke toko ni o tau kainga. Thank you. I also try to say it in our native language, and that's the purpose of the Food Equity Fund, is to help others, you know. This is a great opportunity grant that they shared, you know, with our Pacific Islanders community, that we can also be a part of this great opportunity because we love the food, and food is almost like a number one, you know, wealth for us. So sometimes, you know, they joke around. They said, hey, why don't you eat your food? And that person, you know, even myself, they say, well, I can't eat, you know, it's too late, and plus I'm watching my diet. And they said, it's better to eat and go with your full stomach than die with an empty stomach.
No, I understand that. When I go home to the South and I tell my grandmother, oh, I'm watching my weight, they say, we don't care about that. You sit down here and you eat my banana pudding. If it was good for us, it's good for you. They don't want to hear about your diet.
Yeah, in my Filipino culture, it's like telling people to say, you know, eat is how you tell them how you love them.
And when people come to my house, we make twice as much so that everyone can take food home. Because back in the day, Black people couldn't stop at restaurants. So you always took enough food to make sure you could get home. And so it's something that I still do. I make twice as much and you take it. And the idea is if you have a lot of dishes to wash and no food left, then you've had a lot of family and you've been able to feed them. So that's how you know the event has been successful, when the dishes are piled up and all the food is gone.
Oh, that's wonderful. Thank you so much. And then now we are coming to the end of our program. I will give you this last couple minutes, you know, and before we even, I wanted to acknowledge those that are here. Latu Hakau, just one of our director for Voice of South Pacific. She said, I like the idea of community-driven. And also, Queen Vahoi. Queen Vahoi, ko tuipe mana ko taimi ke whituto ko mai ke kolo e malata. Ke lele e pe e tau food drive, pe ko hai tau ngahi polo kalama ko ia. Ke tokoni, pe a mawai pe a moe whai ngā maari e. O pehe pe a kolo ia e malata. Lahi e nau ngahi polo kalama tokoni. Me county, out for ke city. Ke tokoni i aki a tau kakai. Tatau te whito hange ko ia na whakarea. O ku hoko ai mea kai hange ko tau whai ngā tuku hua whakatonga. Sayang ho mate mā ko naha o mate whekaya. So that's just like I was just trying to say in our language, you know, like they always say, it's better to die that you have enough to eat than die with an empty stomach that you're hungry. But anyway, thank you so much, you know, and David Manukia malo opito kau mai mo ki motoko tape Mary mele latu lui malo opito e kau mai ki tau polo kalama mo ki motoko tape api whaka utamauku ai ko nāsiri ki te ia malo opito mahalo e lava lere ho mo Cover Club ke mo hangau whalere ha mo mea kai pe a kawai pe ko tokoni ke tako tope. Aia ko ki motoko tape lotoni wha malo at ko mo kau mai. Tui fua mausia, ko tui fua ma ko tahai ngai polo kama lele, te mo lava lele pe o whakahoko. Kai kehe pe ke whakahoko I hatu asila I Seattle, pe a kau ke ataha pe ia ke mo whakahoko I ngahe mea kai, ngai whituko mo iai. Okay, thank you so much, you know, and Neta, that's our radio engineer. Do you have any little music, you know, like for them before they're closing up the program for today? Thank you. That's our Pacific Melodious song,
Nice.
all the way with different languages from the islands.
angi mai me he saute Wela e ui ae o tu whenite O ngō mai o hange hango elile O pehe ange mai ke hoko maupe Whalauka pasa me he halata uwha Amerika lahi mo ono whalaua Ono e a whakalata mai ke te kita
Much. That is a little Pacific melodious song that was breezing from the South Seas. Thank you so much for everybody that's still here. Thank you, Wary Tusi Whitley. Thank you for always hopping on our program today. And for those of you that I'm not able to see your name, I do apologize, but thank you all, for just coming in on the last minute. Just know there's a great opportunity. You can tune in on Voice of South Pacific Facebook page, or you can watch it at any time on YouTube, Voice of South Pacific. Either YouTube or you can go to Facebook. And anybody from anywhere can listen to that. If you have any idea, any recommendation, anything, we all take, the words to make us as a better folks, how we can serve others, especially with the Food Equity Fund. Okay, well, I'm going to give you the last thing. Do you have any final words to say before we come to the conclusion?
No, I don't. Just to thank you and hope that we have an opportunity to work with you if at all possible. And if people are not ready, perhaps to do a project, we do have community reviewers. So there's a process where you can apply and be interviewed. And if you're selected as a community reviewer, either for this cycle or for October, we have a stipend of $750 to kind of honor your time. And that's what helps us keep in contact with the community. So if you're not ready to do a project, if you want to be on the ground floor and read and rate applications, it's not as easy as you think. It can be really hard to weigh those community priorities, but it really gives you a good understanding of what we're trying to do. So there's a lot of ways to partner with us, and we're open, and we will be asking for help on how to make the whole process better. We'll also be reaching out to you at the end of the year to give us some ideas on what we could do better. We know it's not perfect, but we want to make it as perfect as we can for the communities that we serve. And that's you.
Thank you so much. Thank you so much, Aline. Hange ko ina nepe. Te ai pe whenga mari ka pau tika ki e mateu teu. O te ai pe me whenga mari o te haui o ka topa. But we have one of our community leaders here, Kalama Takai. Kalama mana ka tahena ngai whenga mari ki mo ngau e aki. E he kau ki mo tolu ko ia i he tano a po e Cover Club. Ki mo ngau e aki ko e ngau ko ilo whako mo loto whitokoni ki he kainga community. Ko e ngai fu ofa lahi eni ko kamata pe panga val mano ala ki takilu. Wao takilu ni mamano. Ka lava pe ai ngai whakaikiki ke toki o atu. Ka oku iai na workshop o kamata e aho atolu ko ni ai ko plelulu ka hau. Hon fulu ke tātātou noa. Ka pate mo lava siai pa tēnā lava pe tokoni atu ke ono whawhono mo application. Ka nau whakaamu ke mau hi wawe taha. Ko i ngā ke mō mao i ngai whangamari ko ni. Ukai ke whangata ngata. Whea pēha whetuu o ku ke iai. Ka ku lava pē ke koe mea tokoni. Ke lava tu whatu pē. Pēk nau ai katoa mea tokoni au ke supplies mo mea ko ia. Ko silinia ko uhi ngaho no mau mai. Ke tautongi aki ai kau ngawe. Ka e tēnā toki atu pē ai ngahi whakaikiki. Ka ku lava pē whe maa tokoni mo whetuu taki mai. Ki telefoni ko i wana ono. Fitu a fitu tolu ono no tolu. Pe komo whetu taki mai pe ke telefoni, wana ono, tolu no anima, walu o. Malo poito. Thank you. Okay. Last but not least, Lona.
Just wanted to thank you, Miss Sylvia, and also thank you to the Voices of South Pacific for letting us be a part of your program. Alin and I enjoyed being in community with you this evening, and I know next week our colleague Lisa Uemoto as well as Zach Ramel will also have an opportunity to join your program and answer a few more of your questions regarding the Food Equity Fund.
Okay, thank you. And now we're back to the Pacific Islanders melodious song. Thank you both. Thank you, Lana. Thank you, Aline. Have a great weekend, and we look forward to another program next week. Thank you.
No olive pena nga fefe o no folata awia isene kai fiutali si heila la veve e mo utalia si kakala fuape si alupe fiu kumi si ane mafua one si utaka o tu ula isuba tapae uhila fakalava ai fofua ifakaha ele si ipele o malaikula Maheni nila minitipe Ikai keru ilo pengalo afe Alua katinofo hopo ate Sai ko walinga singa dito di madara Nisaroi vosa di kongai dela di rombuyara Matava sochi peka kotanga yataka Nalenga kere ni damamu apole amudolada Nungu itau sai konongu seni tau tau Namadam meron mo sindina sarveya Wakawasi minano muy bakarau Enano nita yar mamarau Longo chino matangi lele Tala ua ame maine Etama whanau Samoa ua whai mo sei Lauta aloa maliro Alo sa ilimalo Ua iloai O Samoa i o mao Ua pati mama tau toto si toea ina Tina watutulu ai uale pisa Yoko uli uli lo chino ai mala mala mau mata tamasa
Well, now this is our part 2 of our program. We're going to the King County Public Health, Seattle King County Public Health with Christina Predict. Christina has been very supportive, sharing great information, updates, all the resources, with our Pacific Islanders community for more than a year now. And we're so grateful that she took the time to give us respect and value us, how important it is, for the PI community to stay safe. Ta whamaloen ka Christina Predict, ko e tō tāwhio ne whai ko Officer Whetūtaki ki he Seattle King County Public Health, for te ke maono taimi ke ne ke tuko maha ngai whangamari ke lava ke tokoni mai ka tautolo maha ngai o ngongo pia mai mangai update pia ko ngai mea whuki o tau whiawhia. Okay, Christina, thank you so much and welcome back from the Aloha Land. We've
Thank you.
missed you, and I'm glad. I hope you bring some sunshine back from the Aloha Land.
I really tried.
Yeah.
Thank you so
Christina.
much for having us. And we just really appreciate you, Sylvia, and Voices of the South Pacific, and everything that you do to help get this information out there. Because we really do believe it helps people be healthier and safer. And this isn't possible without you. So thank you so much for having me on.
Yes, it's all things are possible when we come together as a team, as a partner, and you know, above all else, you know, thanks to the Seattle King County Public Health for taking the time to, you know, to give you the opportunity to share with us. So, Christina, thank you again. To, you know, like I have a few questions that was just asking, you know, from the community. I think that one of the questions, you know, since that the mask mandate, hange ko to o ko ya ngai tui ko kof mata, kof malu iko ke mata. And also no more vaccine verification, hange ko tau algo ke wharekai, hange ko pa peak fia ai toko lahi ai. Ka koe tau whakakau kaure waeni, pe ko toi ai nai ha toi mahaki o toi hau. So the first question that was coming, is it necessary to still get the vaccines after they release all the mask mandates and no requirement for the vaccine verification? Is it still necessary to get the vaccines?
Yeah, I think that's a question that a lot of people are asking and wondering about, and also wondering what does it mean with the mandates lifted for King County and what we have to do. So I'm just going to start by sharing that right now, COVID levels are where they were last June and July and November, just before the Omicron surge. So about 52 people per 100,000 in King County have them. So that's considered moderate transmission when that many people have a disease in a community, but it is such a huge improvement over where we are. And a lot of that is because people were wearing getting their vaccines and wearing their masks. So I think just a huge thank you for the community, because really everybody had to come together to make that happen. Why mandates were put in place for mask mandates and vaccine verifications. The goal of that was to stop the spread of COVID-19, because COVID-19 numbers were so high, they were affecting the resources in the community. They were at levels where people may not be able to access healthcare, where so many essential workers were sick, things such as transit and social services weren't able to run. So the mandates were a necessary precaution put into place in order to make sure that we still have the things we count on in King County. And if there's an emergency, we can go to the hospital. And if we need services, that those can be accessed. So the numbers are so low. So we're to the point where there's no longer that threat of emergency. One thing to remember is that while King County as the government no longer says these things are mandated, businesses and your employers might still mandate these things. And that is perfectly within their rights as businesses. I know I went to a coffee shop just the other day and they were asking for vaccine verification. So that's one thing to keep in mind. And I think the other thing to keep in mind is just that vaccines provide an incredible level of protection. So if you are unvaccinated, you are 14 times more likely to be hospitalized than somebody who's not vaccinated. and 20 times more than 20 times more likely to die if you get COVID-19 than somebody who's not vaccinated. So it's a choice that people make, but I think it's just really important to know that your choice could mean that you are severely sick, and it could also affect others around you. Yeah.
Thank you so much, Christina. That's a very good explanation. And it's, based on what you were just explaining, hange ko ni ko ngai fetu uya o ku te alu kita kiai. Neongo ku osito o tuto ni ke tui ake ngai kofu malui. Ka ke alo te ko pe ngai fetu uya o ku ke fe mau e nau tori. Ai ko whakatau taha pea. Ko tuto unia ko mai me King County. Ko ke toi fe mau ke tui kofu malui hangai whakataha anga I loto. Ko whare loto pe ko ngā whai kawa pe ko ngahi ko fepe ngai fitu ko whakata angka kai tō lai e. Ange ko lai peri ko whare kolo. Ka e mei whakata tau ia mo ti penia. Pe ko fepe fitu ko alu. Hango te alu whare maki. Neongo like going to the hospital. Right, Christina? Eh? Going to the hospital regardless of the mask mandate already removed. But they still required people to wear the mask. Because that's where the people get affected. They get sick, going there, and they just want to protect everybody else, Is that right? Going to the hospital and clinic, you still required, to wear a mask, yeah?
Yeah, so in healthcare settings and long-term care settings, if you're visiting somebody in a nursing home, masks are still required, as well as on transportation. And that's a federal mandate. So if you're in an airport, on an airplane, on a bus, or in a taxi cab.
Oh. Hange ko ia ko kawa e pasi, ko hange ko e alu ko taxi, eh? Aia ko, e tipenia neongo o si to e toto ni ko I te whi mau. Pea whakaatare vai, ngai whetu ulahi. Ka me ai peki ngai whetu si now ke still required for you to wear the mask. And it's up to them because it's their business, They want you to wear your mask when you hop in the taxi and the bus. Okay.
Sorry, and just one more thing. I think where we are right now for people, because it goes into this question, and we're at numbers are very low right now, and we're seeing things start to open up when that's so positive. But I think almost every culture, I'd love to know what it is in different Pacific Islander cultures, has a proverb about don't count your chickens before they hatch, or don't get too far ahead with yourself with being excited. And I really feel that's where we are, because things are looking really positive right now, but there's still reason to be cautious, and we want to get successfully over that finish line. So yeah, that's just one thing I want to say.
Thank you. Hange ko ne pepe pe kwai na hatau ki palovea pe wofiof ki ai. Maybe the closest one, I don't have anything right in my head on my thought, but something o ko kai koe lau kafo koe lau lava. Lau kafo, it's just like don't count the worst or the issues. Count what was that was accomplished. Or count, what was, went well, So that's maybe the closest proverb. I'm sure there was the other one, but this is the one that comes to my mind. Yeah. Okay. The next question here that was coming from Tiare from the PICOA, Pacific Islanders Community Association of Washington. What is the status of the mandate now? We see another surge of the new COVID rising. I did not even aware of that. So I could try to clarify. The question is asking, what is the status of the mandates now? Because now we see another surge of another new COVID rising.
Yeah, so I think I know what they're talking about. There's two things that are going on, maybe even three. I'll go through them and speak about them. The first one is that there are some countries that the Omicron variant is just now hitting. So while we've seen really high surges in the US, in the Europe, and now those are going down in South Asian and Southeast Asian countries, they are seeing cases on the rise. And of course, we are a global connected community. So concern in one country can easily translate to concern for another country. So that is one surge that is currently going on. And then, especially in communities where a lot of people are not vaccinated, we're seeing cases go up again, possibly linked to an Omicron subvariant. So it's a cousin of Omicron. And people who are unvaccinated are more susceptible to catching that or catching it again. And I think the other one is we're not seeing the surge in King County, but other places, as people do stop wearing masks and become more social together and maybe take less precautions, there may be a little bounce back with cases going up again. So it's really important to keep things in mind, such as maybe considering how crowded a space is, making sure there's good ventilation, opening the windows if you can, or meeting outside, and just keeping that distance, standing a little back from people when you socialize. In terms of mandates, so those are things that we're seeing globally that are attributing to rises in cases right now. Currently in King County, we're not seeing those rises. So cases are down about 30% in the past 7 days from where they were a week ago. And we're seeing deaths dropping the same way, almost across all categories of ages. And so right now, there are not any mandates in King County, and King County does not have any plans to put mandates back in place. And yeah, we're just hoping that the community really does their part to continue to take precautions and to open up in a safe way, using the knowledge of what we know, everything from washing hands to and even putting on a mask if you think somebody may have been exposed to COVID-19.
Thank you. Thank you, Christina, for clarifying that. So the next question here, are we required to take a fourth shot? Oko keifia maunai ke toi ho ko atu pe te yaha huhu. Takai hono wha ke toi whia mao he fuulahi whau e huhu. Are we required to take a fourth shot? That's kind of a little bit too much. That's just like from the Marshallese community.
Yeah, so if I had a crystal ball and could look into the future, I could let you know that for sure. But right now, there is no requirement for a fourth shot. However, there's a lot of talk about what needs to be done as this virus continues and how we protect ourselves against variants, how variants are stopped, and just remembering that this is a very new disease. This is just over 2 years old that we've had to study and learn this disease. So we don't know yet how COVID-19 will act and continue to infect people. And as the question from Piqua addressed, some places it is going up. So right now, the only requirements for places who verify your vaccine are a first and a second shot. If you are eligible for the booster, if it's been 5 months since your second shot, you are eligible for the booster. That significantly increases your protection against severe disease and hospitalization. Right now, there are no shots authorized beyond the booster. For safety, they're looking at the possibility of that for people over 60. And as we see what happens, There might be more, it may become yearly, like the flu shot is a yearly shot. It may become a series of 4. We just don't know yet. So we're going to have to wait and learn about more of the disease. But as of now, 2 shots and then a booster is what's recommended.
For he takai ko ya na taka mata maki ho loa ki ho pe a ko ho hono tolu pe ai ko pusta pa tau ke lere pe he pusta ai ko ho hono tolu ya pe a tu ko tai mini ko te halau ki to ho fo. Thank you, Christina, you clarify that. Thank you. Ko e fehu I hono hoko. Okay. The fourth question, lots of our people feel better in our Pacific Islander community after removing the mask mandate. So I want to know, is that same as like vaccine and also the mask? Because this is a little bit too much for us to endure having masks for 2 years and also the shot. Do you think it's still necessary for the people to go through on this process here, or we need to go back to the normal life? Thank you. Sorry for the question. I'm trying to translate it, into the English. I'm trying my best.
Yeah, no, you did well. That's I'm glad this asked the question because I think it addresses something very real. It's good for our mental health to have that sense of normalcy, to be able to not wear a mask, to not be able to always worry if you have a mask, to go into places, to see people again, smiling faces. So it is something that is, I think a lot of people really appreciate that. And the goal really is to get back to normal like that. I still wear a mask when I go into places with people I don't know or places that may be crowded. For example, if I go into a grocery store at lunchtime and it's really busy, I might put on my mask. Or if I'm not sure of the policies. So I think it's a tool that's still really smart to use, but it doesn't have to be all the time. And I think just acknowledging that we're living through a pandemic and a new disease. And this is something that is very, very difficult. And a lot of people are struggling with things such as the vaccine and masks and having to do new things and learn so quickly, especially with the vaccines. All of a sudden you had to learn, you have to keep track of different types of vaccines and when you get them and worry if others around you are also vaccinated or not. So I think it is a fantastic thing that we're getting back to normal. And I think just be a little cautious, but these removing the mask mandates is based on science, and it's because numbers are really low right now. So I would say really enjoy just being able to have those normal routines again and to go places and to not wear a mask.
Thank you so much, Christina. I have this question here. I think it was just almost very similar to the last one. She said, thank you for clarifying that. Yes, I wanted to go back to the normal life, but I was started to wonder. First of all, 2020, we have the COVID-19. After the COVID-19, we have the Delta variant. Then the next one was Omicron. I would just kind of wonder on my own thought and my family, why is it just one thing after another after another? Can the King County will try to, and the doctors, Dr. Jeff from King County, can they all try to see or there's any science this study? Is this is like when that one disease finished, one thing coming up, one disease finished, one coming up. Is it going to be continue on like this or not?
Yeah, this is another one of those questions where we don't know. So with a brand new virus, it's almost if you were to get a brand new pet and you see that pet chew the furniture and you train the pet to stop chewing the furniture, but then you find out that it starts hopping on people. Right. So then you have to train the pet not to hop on people. And eventually you'll learn about your new pet and you'll learn what they like. You'll learn why they're trying to get attention. But in the beginning, it can just feel overwhelming. And we're still 2 years feels like a long time, but as diseases go, we're still in the very beginning of learning about this disease. And it's interesting. I was recently in Hawaii, as you mentioned, Sylvia, and we went to a farm where they grow white pineapples. And people were asking where these white pineapples come from. And it was a genetic variation found on near Honolulu, and it was just that pineapples, some had changed a little, and you had this variant that was a white pineapple. And it's not human, it's not human, humans did not make the variant. It's just the nature of living things will genetically change and evolve. So that's what's happening with the virus, and that's why we have these variants. So as we learn more about the disease, as the disease evolves, there will naturally become more balance with how COVID and humans interact, and hopefully less variants. But yeah, I know it can be really overwhelming, and unfortunately, we can't know what's coming next. We can just do the best with what we have right now. And I think one thing to remember is the more the variant passes from person, or COVID or the variant passes from person to person, the more chance there is it will change. And when it changes enough, it's new and our body doesn't know how to handle it again. So I think that's one thing that everybody can do is help stop the spread. But I just want to acknowledge the question that we all feel that way, even within public health. It feels like we're making such progress, and then there'll be a new variant, and yeah, and it goes backwards. So yes, I appreciate the question, and we feel the same thing. And unfortunately, we don't know, but we do know some things that can help prevent it.
Okay, thank you so much, Christina. I will just take a little 20-second here for a little melodious from the islands, Pacific melody, and then only 20-second, and then we'll continue on, finish the last part of our broadcast. Mm-hmm. Hi, Christina. I'm sure you heard all this music, those Polynesian melodious music, Tina, while you were in Hawaii. Hope you have a great time over there.
Thank you.
Yeah. I have a question, and this one here very similar to the last one. It's asking, I've seen a lot of people going through COVID-19 testing now. Also, I got the home testing for the COVID-19
Mm-hmm.
and not the vaccines. Why is it um, putting a lot of emphasis, on the COVID-19 testing, but not the vaccines, like how they did before last year? Thank you.
Yeah. So I think one thing to remember is over 90% of people in King County are now vaccinated. And that's amazing. And we would love for that last 10% to get vaccinated. But with 90% of people already being vaccinated, King County also has one of the highest booster rates in the country of people who have got their booster shot. So there's just not a lot of people left to get vaccinated. So still a very important message. If you're not vaccinated, now would be a great time to become vaccinated. But testing is our next tool to kind of stop prevention, because even though the illness is not severe with the vaccine, if you catch COVID-19, you can still spread it. And that's especially true if you're around somebody who's immunocompromised or children who cannot get vaccinated. During Omicron, we were seeing some of the highest case rates in children under 5 years old. So if you're not sure, testing is a fantastic tool. So if you're maybe going to a household where there's somebody who is, say, going through cancer treatment or at high risk from getting ill because they have, maybe they have diabetes or they're immunocompromised, testing is really good to know before you visit whether you're putting that person at risk or not.
Whamatala, o ko pesete hi wanoa o e kakai ko i King County ko osi hukina tolu. Pea ko pesete lahi tahaini i Amerikani. That's the highest rate in the country.
Yeah.
That's mean our people were okay and they wanted to stay safe and they take the vaccines, and 90%. Right, Christina? 90% in the
Yes.
Seattle King County
Yeah.
Public Health. And that is hange ko yan and whamatala mai. Maha ko maalunga tahaini ai kakai ko na ngau e kai ho malui i Amerikani ko toa. Tau fia talango fua pite tau county. Pea ko mea ko mo uilere ai kakai ho tau fituun. Thank you so much, Christina. I'll let you, have any other resources that you think that maybe help others or in the community. You can go ahead.
Yeah, I want people to know, one, if you test positive for COVID-19, either with a home test or by going to a testing center, there's still resources available to help with isolation and quarantine. If you need a room away from your family, if you need things like grocery delivery, those resources are still available, and you can navigate to those from kingcounty.gov/COVID. And if anybody tests positive or you have symptoms such as a cough, a scratchy throat, a fever, COVID-19 is still very serious. There are less cases in the community, but it is still very serious. So when we're lifting mask mandates and there's no longer vaccine verification, remember there is still a very serious disease. So please isolate if you have those symptoms. And I think together as a community, there's so many things we can do to stop the spread of COVID-19 and to keep the numbers low, and to make it more permanent that you don't have to wear masks and you don't have to worry as much. So I think that's one thing to really remember. happy to answer any questions about the vaccine if people are still hesitant or unsure about it. I'm happy to explain how it works, why it works, and to answer any questions, because the vaccine is really what's helping. So yeah, I would love to. Yeah.
And here that's keep coming up. While you were explaining that, I think this person here is asking the question. I've been testing like 3 times
Mhm.
on COVID-19, and it's coming up negative. So, do you think that I still required to do the vaccines, or I should just stay because I am still safe and I'm not getting any positive on the COVID-19 testing? So the question I think that this person was asking, she's been tested 3 times and coming out negative. She's asking, what your recommendation? Does she still need to take a vaccines or not?
Yeah. So I think that's great that she's testing negative because it is a very severe disease. And there's a lot of reasons people might have symptoms that feel similar. So we're going into allergy season. So you might get that scratchy throat or sneezing or feel really tired if you have bad allergies. During the winter, if you're inside with the heater, the air usually gets really dry, so you might cough, and that can make you worry that it's COVID-19. So even though the person is testing negative now, it does not mean they've necessarily been exposed or that they'll have immunity when they are exposed. So it is still a very good idea to get the COVID-19 vaccine because maybe the cough is from allergies, but you never know when you might be close to someone who has COVID-19, and then the likelihood that you will catch the infection is double what it would be if you were vaccinated.
Hange koe na ne whamatala mai, ko tō tahe koe nina tō tolu e ne alo sivi. Aia koe tō tolu e ne sivi, pea asa ke pe koe ke mau ia e COVID tahi wa, o hao pia mea. Pea koe ne whehu I lewa, o ke whia mau nai, ke alo o huhu. Ko I ngā koe ne o hao pe no sino o naia. Pea koe whare I koe ne o mai. Neongo pe o te hao, ka koe whakapoto pe, koe huhu malu I pe. Aia, hangerewa koe tau fit into our tongue and proverbs, it said, tae la ngoke mamau. Tae la ngoke mamau. Just like hit the flies, before they come and stand around, and spread germs in your food.
Yeah.
So tae la ngoke mamau. Lango mean flies. So, aia koe hangepe, prevention is better than cure. Hangepe ha te teu pe ki mua. Neongo koe ke maase o mao koe ka koe anga ne whamatala me whalei ngai whatotala whasai nisi. Mau inga pe e te malu I pe ki take I taimi. Ha te toki hoko hake ko uesia hoto sino pe koe ha. Koe malu I pe koe haho whakau kau e mea koe sai ka koe pea koe ia pe. Thank you so much, Christina.
Yeah, and I just want to share some numbers because I think they're very interesting. So we've looked at recent positive cases in King County, and we can see the difference between people who are not vaccinated, for people who are fully vaccinated, and then for people who are boosted. So what we know is if you're not fully vaccinated, there's more than double the chance that you'll contract COVID-19 than if you are fully vaccinated. And even when you catch infection, we know the vaccine protects against severe illness. And you can see this with hospitalizations. So if somebody is not fully vaccinated, they are 14 times higher to be hospitalized than somebody who is vaccinated. And if somebody is boosted, they have an even smaller chance. So if somebody is boosted versus fully vaccinated, or not vaccinated, the not vaccinated person has 170 times more likelihood that they will be in the hospital than somebody who's boosted. And with deaths, over 20 times greater likelihood that somebody will die from a COVID-19 infection than if they're unvaccinated versus fully vaccinated. And if they have the booster shot, that cuts by more than half. So boosted people versus unvaccinated people are more than 40 times more likely to be hospital or to die from a COVID-19 infection.
All great information, and it's very relevant, and thanks for the update. Thank you for everything. Now we'll give you the we'll give you the last opportunity so you can keep sharing any other resources to the community abroad. Thank you.
Yes, so kingcounty.gov/COVID is where you can find information, including in other languages, about COVID-19, getting your vaccine, getting tested, even answers to some frequently asked questions, or if there's things you're not sure about the vaccine, a phone number where you can call and ask questions. And if you're having trouble in general because the pandemic is ongoing and has caused a lot of hardship, you can go to kingcounty.gov/outreach. And there you'll find a list of all the resources in King County that can help, from help with transportation to groceries to other resources.
Koina ko si toko ia tupe mau le te ensina malo pitoneta ko kingcounty.gov/outreach kingcounty.gov/outreach. And what is the phone number? Is there a phone number again?
Let me bring it up, just one moment.
Okay, that's fine.
Yeah.
Thank you so much, Christina, for compiling this great information. Ngahi whahino no lava toko ni lahi opito. Ka paupe ke whe mao ka ngai toko ni ngai tawha akeke. Hange ko mea koia. Hange ko e neongo pe ko oset mo liliu e ngahi whahino koia. Hange ko e rental assistance. Hange ko ngai food benefit. Hafa ngai polo kalama toko ni ngai supplies mo ha ngai mea koia. Lava pe ke alu ke kingcounty.gov/outreach. Okay. And the phone number?
It is. We just rearranged the page. So, okay, the number is 206 296 0881.
Ko e telefoni ko e wanoaono. Katak pe neta tu koe tu wanoaono. Uahi vaono no avalval taha 206-296-0881. Wanoaono. Uahi vaono no avalvalu taha. Ko ia ka paurewa whengata mo al online te mo lava peo taha ngā tona ke peki ai ke tokoni kia ki motolu. Matlo apito. Thank you so much, Christina. Thank you so much, for all the time you're coming in and update us. And we do miss you, but we're glad you're back.
Thank you. And one last thing I want to point out, at kingcounty.gov/outreach, you can also find community health events.
Oh,
so
okay.
These are free events with things such as different health services from, you can make appointments for mammograms, you can have your blood pressure tested, do dental, sometimes there's dental services, and the COVID-19 vaccine and other childhood vaccines. So if you'd prefer a community event over going to a clinic, you can find that on the website.
Okay, thank you so much, Christina. Ko na grava pe tuku iatu ko alpe ke kingcounty.gov be osko ya kai pe ngahi program hangi ko nifo dental health event be ko na postuka pe me fika telefoni ko wano no ua hivano no Valvaltaha 206-296-0881. Ka pau ke lava pe tāki ai, ko ngā ke maha ngahi whainoi na mga tokoni, ke nā ngai polokalama ke kehe, ke tokoni atu ki a koe mo family. I think I just saw this last one here. I'm so sorry, Christina.
No problem.
Just this person here was asking, you know, how is the King County compare to any other counties in the state of Washington, the King County?
Yeah, King County is one of the lowest incidence of COVID-19 right now, and that's because we have the highest vaccination rate. There's some communities such as Vashon Island that are reporting no new cases. And we're seeing it drop even in areas of the county that have been high, such as South King County. So we are very fortunate to live here and that we have a wonderful community that's following COVID precautions.
That's wonderful.
Yeah.
Thank you so much, Christina. Thank you. We are so grateful that you take the time, and we will definitely will distribute and also share it, you know, with our communities abroad, especially our Pacific Islanders, you know, Samoan, Tongan, Fijian, and Marshallese, and also any other relevant other language. Sometimes we share it with the Filipino too. Yeah. Thank you so much, Christina. And you have a great weekend. Thank you for all the resources.
Thank you, Sylvia. Good night.
Have a good night. Thank you all. It's a little song. Ko e lava lele ia ai polokalama ko ia pe ai King County pe mo Christina Bredick pe he foki ke polokalama ko ia ai Food Equity Fund. Ai ko programa ne toko ni ka ngai kulupu ke lava ke mo mai fanga marigo ka mata pe ai me ai ofa kon me toko ni o grant ko ni ka mata me pa nga valmano ke ta kilo tupu o o ke pe ke ta kilo di pa mano. Fa te fita me he o ki i ngawe ko ai ke fai. Pea koe konga honoa, koe ngai whai no ina pe mai update mai ki hea, ngā koe ia tuunga koe wai King County, pea moi Seattle King County Public Health, aina o atu ia Christina Bredick. Koe ni ka tau te wā ki atueni ki he si ngahi whamiri tō tono ai ngahi apsia. Hange koe ia koe si apsia e nima wa mana ki tau hokat ki ai. E aha koe ia pongpongi, e aha po ai, ai mea whakaeki ko ia o sisi wha whainga tapa atou tai. Ko e pekian a sisi wha i hono tau whango fulmahi wā. Ko e neongo mātu a. Ko ānau e a mowiliam whainga. Aina i loa ko ānau mila. Ko na ofe fine lahi. Ko Paulini whainga pinomi. Whikaua ki ai a te isa whainga whinau. Pe whikatolu ki ai ko e ongo mahanga. Ko i kani whainga na ane mama o atu pe na ane pekia i he maasi o i wāwhe. Pea kono mahanga eni a siswha whainga tapa atou tai. Na ane pekia i he pulelulu o i wike koosi. Pea te waki ai whakaheke heka. Pea moe whai ahono āpō. Moe whakawhe ao ki he pekia. I e whiawhi koe a pongpongi. Pea hoko atu ki ai a Nesteko whainga tawarii. Pea hoko atu ki ai a Stephen Miller, ko taha peo e whanau ka na e ohi a ke peia e whamili Miller. Pea sisi taha ki ai, ko e ongo mahanga, ko sia utu, ko sia ki holewa whainga utu. Pea mono mahanga ko viriami whainga. Aia ko ki nau toluia, e ko ongo mahanga pe sisi whainga tapa tautai pe whoki kia ikan whainga pōna pe kia. O amanaki ke whahoko ai mea whakaeiki o sisi whainga tapa tautai. I he whare lotu ko ia I loa ko Renton United Methodist. Renton United Methodist Church, aia ko tua sila, ka taki moa radio engineer o tuku atu ko Uoua no ataha, North East Street. Renton, Washington 98056. 2201 North East 4th Street. Renton, Washington. Te te whakaongo atu. The celebration of life of Sisifa Whainga Tapa Tautai will be at Renton United Methodist Church. I whare lotu e Methodist whatataha e Rentoni. Ko tu asila ko Uoua no ataha, North East 4th Street, Renton, Washington 98056. Uoua no ataha, North East ay ngawi akipe NE Halafa 4th Street, Halafa, Renton, Washington. Ai ko ki motolu ko mo ilo alu ko ki Renton Tech, te kaka ke pehe ko alu ko halatolu. Ai ko halatolu hoko pe ko fa ko te ki kaka time si ake pe ko laki afe he ma pe ko afe ya ko ki he fare lotu. Ai te alu tai ko pe mo fa toka ai o kuofi pe ai. Ai e whakahoko ia I he whiawhi ko a pongpongi a po a wani mai e peleri. Whamore more. Aho taha walu ia o maasi. Aho taha walu o maasi ai ko e whiawhi a pongpongi. Pea I he aho taha hiwa, aho tōna ki ia. Whae lewa aho no malanga I. E tataki ia e siaso tonga hou eki. Pe hen whakmana whaiwhikau pure. Whaiwhikau sone whataua. Pea hiri ko ia e whakahaele ia toi pe ki hono whaitoka. A ia kono api no whaanga mau ia. A ia ko whaitoka pe ia o kuofi mai pe ki he api siasi. A ia ko I whiawha pongpongi whahoko ahono apo. Ka mata pe apo me taimi ono he whiawhi ki he tahataha po uri. Pea osi lewa. A koe ki he pongpongi ka mata pe a malanga I o mea whakaeki me he taimi walu pongpongi pea osi pe I haki hawasi pe me iai. Ko I ngā koe hongo fulu, ko whakahoko lewa no mea whakaeki, ano wau ko ia o e whakahike heka o mea whakaeki I he whaitoka I he taimi hongo fulu pongpongi. Ko ia, ko e maha koe o ngongo wha mui mui peia, atu mai tau pekia, pea atu ai pe moi mau ofa me he letio, le o Pacific Saute pe ke radio tonga Seattle me Seattle Washington pe ke ofalahi atu fonga atu ai Seattle Tonga Relief Committee mo Palestini Tony Puloka ai ofalahi atu sisfa ki te ko pe a ko ai ko e ongonga fa muy pe o lava ke mautu atu ko ma foka tala pe a me family ko ia o Palu ai a ko Lute Palu Whekitoa, Mohono Te Hina ko Naomi Palu Cook. Pea ma ena ngoki I whanau e toko ua ko ia ko Akimata, pea pefo ki Keola James Cook. O ku whahoko katoa na mea whakaiki, he whiawhi whalaite o wike kāu, aia koe maasi ahua ni maia, pea whakahoko ai pe ahono tanu I he aho tōna ki. Pea toki whanongonongo atu, pea tuku atu, ai wheitu uko ia o whahoko ai mea whakaeki. Koe mahala koe ngahi ongongo pe, ko mai me ngahi apsia koe ni, pea te tautoi polokalama pe I ahamoni te, pea moi whamiri koe, ka ku ki mautolo koe ia na e kai ke mo mao, ai polokalama koe tu site, na o atu pea rea whaosi, mo rea tatau, ai pekia, asis whainga tapa tautai, ko whatafa community, pia nane si I tolo I mata pe, o vahe ai ne whakaukau ke tau ofa mo tau tokoni ki tonga i he wawe taha i he whatamaki koni na e hoko i tonga. Pea ko ia, ko whepea whetu o ke whananga mai me ai, pe ke mea mai me ai. Whaka o ata e ofa me he pekia, ko i ngā, ko ne viritaki ke whai e ne ofa, pea ko i ngā koe whalaite, na e hauai pe ke whao e ne talamu me ato na ki, mo ne ngahi ofa ke whaka o ke whamiri o no spaniti ki tonga. Pea, ore ke pule lulo wiko o si, na ne si tatau mai. Pea ko ia mau ofalahi atu heni, ke whae, ki anau whainga, pe ke whamiri hono kotoa, pe kai ke ngatai, mau ofalahi atu, ki he uitou, wā ke tapa atou tai. Ke toka i he nonga mo whia Māria e iki, ofalahi atu siswha. Pea koe ni koe hiwa pe ni pea me sasa o tonga hau iki, mo nau whai lotu, whaka osina e whakahoko, ane e whiawhi, koe whai pe ai whai lotu, koe whanonga mo whakawhia Māria ki he aptanga mamahi. Koe ne o atia i taimini. Fofonga o e si i whamiri koe ne toko whā, ko nau tō tau ki nau tō, amena ke whahoko ia i whalaite o i wike ka hau, ma asi ahawani ma mo e ahawa ono. Ka koe ne o ati pene ngai hiwa koe i asasa o tonga, hiwa ko ia nā tau taku whanonga ki ai, ko e nofo whakataimi pēni. Ko e api ko e ni tau iai, ko e taimi whono no pē tau whanonga, ko e tau nofo pēni. Whakataimi pē ai mea hono kotoa. Ka mahana mō mea mai pē ki he lai ata koe nei tuku atu, ma o koe whakahaa pē me si i ho ek whawhine koe au saso tonga ho e kina nau pē he, ko no lai ata eni me he sepitema tari ui ko ia o e wāwhe ua taha ai ko tau ko o sia. Pēnā ne pehe pē. Sai pē ka pau mahana ko whaka o si a kueni. Hange pē koe ha ane tala tuku pē. Ne whanonga ai i he nonga mai whia maria e eki. Pēa ko ia na e mau kau whatafoki pēa moe whaiwhe kau so sai a vi, pēa moe si aso tonga ho eki. Ane whiawhi o whai pē e nau whawhe a me nau whakawhia maria ki he uitou. Kia wāke tapa tautai, pē whoki ke whae, kia anau whainga, pē whoki ke whangatoko wa, kai maa whoki ene ki i whanau paia, ka more more pēnā pē ko ngalo. Ka koe nā ko lawale rei, ai te waki a hono whakeka, pēa e malanga i he pongpong tōna ki, kai whakahoko e a pō i whawhi a pongpongi, pēa koe nā pē o stuku atu pē ai tua sila, ke mō mea mai ki ai, whahoko i wharelotu ko ia Renton United Methodist. Aia ko wharelotu ia o Sias Metotisi. Ua noa taha North East Halafa Street i Renton i Washington. 2201 North East 4th Street, Renton, Washington 98056. Whahoko i whiawhi a pongpongi. Kamata pe me he ono ki he oski he taha po uri. Pea kamata lewa pe i he taimi walu pongpongi pongpong tōna ki. O osi pē ki he hongo fulu. Aia koe lava ka katoia, ai polokalama koe ai ahoni, te mautoe lava pē o mau ai tatau e polokalama i he YouTube live, pē te mautoe lava pē o sio ai i he Facebook. Ia whahinga taimi pē, ka pau te iaha mo whee ilo ke ngai polokalama koe na mau atki mua, ko ngai polokalama toko nia ai pureanga. Malo au pito, e tau kau whataha, ko tau au mai ke wha o singa mga polokalama, wha māloa ko whepea wheitu na ke mea mai meai, wha māloa te tau kau whataha i he polokalama ko e ahoni, o atu ia pea me he le o Pacific South te Voice of South Pacific Broadcast in Radio Tonga, Seattle. Kini mo tau whahao a, kau Silvia Fatima Aho, pea ke mau ensinia ke lava leire a polokalama, ne tatua tāpea lava. Malo apita mau mea mai, ka mau mea.